I'm Rita Nguyen. I'm the Medical Director of Community Engagement and Healthy Food Initiatives at UCSF San Francisco General Hospital, and I'm really proud to be able to be moderating this panel of how women in healthcare. So according to an article in Modern Healthcare last April, 78% of all healthcare and social assistance workers are women. However, only 26 of hospital and healthcare system CEO positions are filled by women. The good news is that the healthcare sector is ahead of other commercial sectors where women comprise only 15% of CEO positions at Fortune 500 companies. Yet more progress is clearly needed. So I'm pleased we can highlight the careers of these accomplished women on the panel who are paving the way. And with that, I'd like to introduce you to Liz Helms, Amy Lee, Adita Koxic, as well as Terhilda Garrido. And I'd like you all to spend just a few minutes describing your work to the audience today. You can start, Liz.
Good morning. Does this sound okay? Or is mine echoing? Good? Okay, great. Okay, thank you so much, Rita, for having us here today. I'm delighted to be here. I'm the president and CEO of the California Chronic Care Coalition, and have been in that role since 2006 when we started. We came together at the request of the Schwarzenegger administration to get the voice of the patient at the table during healthcare reform when 2007 was the big push in California. And then when that failed to really pass through our legislative process, it went on, and a lot of the work that we did in California went into the ACA. California was way in front on the work that we did. And we worked very hard at securing patient protections and kept keeping in our regulatory authority in California, which we were able to accomplish. So all of our mandates at Knox-Keene have stayed together. And talking today about, you just want me to pass it on and we just do an introduction? Okay. As being a woman in the healthcare arena, not a problem. It's the voice that matters. It's the voice of getting everybody together and really not being afraid to speak up and speak out. And that's what we've been doing for a long time, but we have, we're headed to the 40 member mark. Now we're really growing in size, and we have like the American Heart, American Diabetes, MS, epilepsy, smaller group sickle cell, lots of different diverse organizations that make us up. Most of the government relations and policy people, most of the group are women. So when you get a group of women, sometimes the barriers I find are sometimes the women themselves and us working together, but the men have come along and have a great seat at the table too. So it's a shared decision-making process.
Hi, my name is Amy Lee. If you guys participate in our dance this morning, let's go back. Okay, that's fine. If you guys see me dance this morning, you know that I'm founder of Dance for Healing. We're going to show a 2-minute video. Let's go back and restart.
Physical symptoms due to stress, 73% psychological. I was one of them. In 2011, I ran a marathon. In 2012, I was fighting stage 4 cancer. It was very hard. I won the battle, discovered the healing power of music and dance, now inspired to give back to the community that supported me. When people get sick, they not only have physical fatigue, but also huge mental stress, and become a roadblock to help them feel better. Creative arts therapy improving quality of life for cancer patients by 50%, reducing pain by 59%. Dancing frequently will reduce the risk of dementia by 76%, increase serotonin, oxytocin, and make you feel more loved and trustful. This is crucial for patients who's going through the most difficult challenge in their life. Patients are also homebound and very easy to fall into depression. We specifically designed our virtual dance platform to address this problem. Based on neuroscience, Dance for Healing uses AI behavior design and gamification to recommend personalized music and dance based on how you feel right now and your health condition over time. Enable them to dance with friends, family, cancer buddies, anyone, anytime, anywhere in the world.
Now open your eyes wide. Tight shoes. Open wide.
April 2014, we launched our first pilot. Let's see what the patient have to say within 4 weeks.
It's just a great class for me. I tell everybody, I wasn't sure about the, when you're on the computer, virtual. I like that now.
I just think how maybe I only can dance for 15 minutes.
Yeah.
But now, just say, see, I have some muscle here. I can dance for an hour, no problem.
Yeah.
So really, I get my energy back.
I met an amazing group of people. We are open-minded. We want to try new things to help us. We are very brave, I think. And we dare to express ourselves, even we know that we are not the best dancers in the world. So we are so fortunate to have all the amazing teachers. You really made a difference in our life.
So what we're trying to fill is two gaps in healthcare. One is bring up awareness how music, dance, and art could be one of the most cost-effective way of help healthcare system reduce cost. You saw the data in dementia. 1 out of $5 right now in Medicare goes to Alzheimer's. And by 2050, it will be 1 out of $3 will go to Alzheimer's. And that only accounts for half the dementia. So this can reduce 76% of dementia. I think we should tell Obama and Michelle to dance, right? The other gap that we try to fill in is, I think doctors try to do a good job as much as they can, taking care of patient in person. As soon as the patient goes home, there's not much support there. Even the doctor is really care about their patient, they can't really do much. And right now, the telehealth has a little bit happening, simple doctor visits, but we wanted to push that one step further. So we built this very robust technology platform using WebRTC. We just won the first prize at the AT&T Enhanced WebRTC. With the technology, we enable exercise, fun, human support to bring to patients' house when they struggle with their healthcare struggles. Part of the challenge that I have is trying to figure out how do I sort of navigate myself through the healthcare system. And so we are offering a limited time free trial. We just offer a technology platform, but we decide ahead of time what outcome measurement that your organization cares, that we will help you track it. By the end of like 1 month or 2 month trial, if the outcome increase, help us figure out a sustainable model where it makes sense for your business, help you reduce costs, and also help the patients getting benefit from this. Thank you.
Good morning all. My name is Edyta Kotyk and I'm co-founder and CEO of Sidely. Sidely is a telemedical startup. This is part of our team. We are a young company. We are focused on wearable device who could help seniors and patients to diagnosis process. I have one question to you. Do you know how your loved one feels at the moment? How feels your, for example, your grandmother now? Or how will be your reaction when, for example, your grandmother fall over and you don't know about it? I understand. Okay, just a second. I understand you because I know that most of us have a lot of daily duties and we can't be all the time near our loved one. But I have solution and I have devised solution to this problem. This is wristband. This is medical device. I haven't got time to describe all the function, but I would like to say that thanks to our device, you know how feel your grandmother, your grandfather, your loved one, where is she now, for example, and you know when, for example, she for over or feel not well. Of course, we have all the system, but I would like to say more about maybe about our achievements, because when I prepare my presentation and when I prepare to this speech, my organization told me about our achievements, and I would like to say that the most important achievement for us is that our customers. We start to selling our product 3 months ago, and we have a lot of clients from 12 countries. There are family, one is the person who is ill to dementia, Alzheimer, or cancer, and we try to help to this kind of family and guardian those people. Okay, so thank you very much.
Thanks. My name is Terilda Garrido, and I'm formerly with Kaiser Permanente, where my last role, after having worked there for 29 years, was Vice President of Health Information Technology, Transformation, and Analytics. I currently am running an independent consulting group that builds off of the learnings from our experiences at Kaiser, called Camino Advisors. At Kaiser, I ran a small internal strategic consulting group that really tried to bridge the gaps between health information technology and actually operationalizing. So some of the panels this morning spoke about the challenges in making technology actually work and where the rubber hits the road. And that's where my group came in to try to help optimize and try to improve things. For example, we did a pilot of the first personal health record at Kaiser Permanente. Some of you may know it as kp.org, but when we added lab tests and the ability to securely email your doctor, we grew from a base of about a couple of thousand members to now over 5 million members that now regularly access their own information online. Some of you may have experienced it also. That started from a pilot that we did. And there are a variety of different successes, many tries, and many failures, but that's the price of innovation. I also had a group that regularly accessed the 12 petabytes of data that the electronic health record supplied us. And so we had experience in using that data to help improve care and care operations. So that's Terilda.
Thank you. I'd like to ask each of you what you perceive as one of the greatest barriers to innovating in healthcare and how you've addressed those barriers. Maybe we'll actually start on the other end this time. So Terilda, do you want to get started?
Sure. And this is really at the rub. Again, I feel fortunate in having worked at a place like Kaiser because it's a hospital system, it's an insurance company, and it's a group of 18,000 physicians all trying to work together and trying to remain aligned around improving care overall. I think the biggest challenge is and again, we heard it in many of the panels this morning, the complexity of healthcare, right? It's the regulatory, it's the security, it's the patient's voice, it's the fact that there's social aspects, it's behaviors, it's how you, family caregivers, and how do they stay in the loop and do what they need to do, as well as physician concerns, nursing concerns. We've heard it all this morning. It is that complexity that we are up against, and health is a complex question. There are many factors that go into people's health, so it's not surprising that healthcare is also complex as well. I think to some degree in the United States we've done it to ourselves a little bit, but how do we sort through the business models? How do we sort through the regulatory privacy questions? How do we sort through the patient's empowerment and patient voice? I think these are all exciting elements, but it also leads to that complexity and challenge of how do we get all of the alignment that we need to have in order for innovation to actually hit the road and be effective at scale, not just for a few patients, but at scale.
For me, as an entrepreneur, we kind of speak, I'm so glad there's a Kaiser person here, because I complete coming from internet technology and innovation and design. Because of my cancer experience, I just want to do something more meaningful for me. But I'm struggling with figuring out this healthcare puzzle and where to fit my piece in. Even though there's clearly from the data there's a huge need for what we do, working with healthcare executives who doesn't really know how to put our costs into their system, we struggle with even providing program, having patient requests to have the program started. It's been delayed, and because they don't know how to fit into their current existing cost system. So that's one thing that we need to figure it out. Like maybe experiment with different groups and experiment different models, which is kind of what we do. Like after realize how slow it is, especially from an internet technology person. Now we just experiment. We already got this technology platform. Go try it. If your outcome improve, then that's top. And I'm a little bit more open now versus at the beginning. Like, okay, I'm gonna get a major healthcare group to join, and we did get one. I don't want to mention which one. And luckily, also we have another clinical trial setting up with Stanford. So that one is moving forward smoothly. However, it's also quite slow. So for entrepreneurs like us, we had to figure out, when I first started, because myself is a cancer survivor, and I didn't feel comfortable charging cancer patients who come to this program. Even though my advisor told me that you need to at some point make it sustainable. Because I started with my heart to help these patients recover because my struggle going through cancer. But that's not long-term sustainable. I can't keep begging all these teachers to come in to teach for free, filmmakers come in to film the classes for free, and our programmers just uploaded these videos to the platform to continue coding for free, right? So we need to figure out a sustainable model, and I'm sure there's a lot of entrepreneurs like myself, like trying to figure out, and we need have a lot of healthcare executives here, so maybe it would be helpful if there is some kind of mentoring model where these executives, you guys know how to navigate, you love innovation and helping entrepreneurs like us, figure out a pathway, even just figure out a way to test it, way to try it. Data speaks a lot in healthcare, but we need that initial platform to get it set up.
Okay, I would like to say that when I set up my organization, I started with mentoring and foundation, the Women Foundation, and it was really support for me. And now we have a big challenge to education society about the telemedicine, about how using our device, what is the telemedicine, and in Europe, because we are from Europe, the telemedical area is not material than in US, and I think that the most important for this kind of company like me is the support, another one of course, but is the support to grow the field of telemedical and also complex healthcare.
Thank you. Well, when we started our organization, our organization is focused on access to affordable quality health care, team-based care, total cost of care, but we're patient-centric. So you heard Dr. Robbins, who's my very dear friend, talk about patient centricity. We have a fragmented healthcare system, and to hear the speakers this morning who did such a great job of outlining some of the problems in the system still, our system is very fragmented. What we are trying to do within our organization, we represent about 16 million people in the state with chronic disease. We're really successful when we put our teeth into something, we're really successful. And we do that because we lay out our stories. We don't let those barriers stand in our way. We have to figure out how we roll through those barriers and push that rock up that big giant boulder up the hill. And sometimes we make it to the top, and sometimes it flattens us down, and we pick it back up, and we roll it back up until we are successful. Because we have to be. We're talking about the lives of people. We're talking about the lives of families and productivity within themselves and their mental health because they can't get care. And a lot of depression because they can't get the kind of care that they need or it's not affordable. So what we have been able to successfully do is break down a lot of those barriers by getting everybody together. And let me give you an example. I'm sure all of you are aware, we're trying to build that infrastructure for innovation. Until we build that infrastructure for innovation where we look at everything and figure out how the technologies have moved so far ahead. I mean, we're looking at DNA medicine and genomics and personal medicine. We're seeing people live with HIV, where AIDS, I lost 6 friends to AIDS in the 1980s, and now HIV is a chronic condition. And we look at hepatitis C, which had all this controversy about the cost, but the value and the cost could override what that base cost is, and we don't really know what everybody is paying for that medicine. So when we start talking about how do we build that infrastructure and how do we move those mountains up, move them aside or get up the hill, everything is doable. It's when you feel defeated and you don't want to move forward or you take no for an answer. I can't tell you how many fights we've had in back rooms, but I have to tell you, here's the example. 2 years ago, when Covered California started, 2014, out the door, we knew that the co-insurance costs on specialty meds were outrageous and that people were not going to be able to afford to get their meds. So we decided, and this is what I heard from people on pushback, no, you can't do that. You can't go to Covered California, you can't have that discussion, let them get out the door. And we said, no, we can't do that. People are going to get hurt. And if in fact they've said that this is affordable and it's not affordable, it's going to hurt the ACA and the exchange right out the door. So we got together, we brought everybody in the room, and we started having the discussion. And then Covered California, bless their souls, did a stakeholders meeting. They brought everybody in the room. So the health plans were there, the patient advocates were there, consumer groups, pharmaceutical companies, pharmacies. Everybody was at that table having a very difficult discussion, and guess what? They all decided to cap the copay. That was our group starting that. We decided that if you take people with chronic disease and you set up a completely different payment structure for them, that's discrimination. And we won that issue. And then it went on, it took off like wildfire all over the country, and then CMS got involved with the proposed rule. But the fact that, Kaiser was one of the first ones that said, we agreed, we're going to do it. And we saw change without having it go into legislation. It went into legislation last year, which was AB 339, and that was passed and signed by the governor, so it goes into statute starting next year. But we're all working together, and now Covered California has their quality work group, so we sit on that. There are ways to do it. Never feel that there's a barrier so big or so high that you can't get through or you can't break that glass ceiling. And we can do it, and it was women and men together making that happen.
Great, thank you. I wonder, what are your thoughts on being identified as power women in healthcare as opposed to power individuals in healthcare? How do you view yourselves? How do you want fellow female colleagues to view you, and how do you want male colleagues to view you?
Sure. Well, I think there are advantages and disadvantages, and I see in the audience we have lots of women, so I'm imagining we have as many opinions about this issue as we have people in the audience. But I think part of the advantages that women tend, statistically, that's my background, is statistics, is we tend to be the caregivers. We tend to be the ones that aren't just worrying about our own health, but worrying about the health of our family members and other people. That's a statistical truth. It may not be true at an individual level for everyone, but and so I think there are natural advantages of being key decision makers and understanding those paths and understanding the challenges. So I think that's a natural advantage, and that's great. I think the challenge, of course, is that although we are oftentimes a large number of the providers nursing, there are a vast majority of nurses are women, and in all fields in healthcare, I think it naturally draws women. The challenge there is that they aren't necessarily the decision makers, right? Back to the statistics that you shared at the very beginning of this session. The number of CEOs, the number of boards that have women or are led by women is much lower. So the challenge really is not in participation. The challenge is in the leadership and decision making. That is the problem and the nut to crack, and to crack on an ongoing basis. Because although we are in a rarefied atmosphere right now here at Stanford, in California, in the Bay Area, there are still lots of places in the world where I can't even begin to name the challenges that women have, right? And so that's just the realities of where we are. So how do I feel about being identified? I'm very proud. I feel like I've had advantages by being a woman, by being a Latina in healthcare. It gives me insight. It gives me the ability to understand that I can bring to the table, and that's great. But I also know that people look at me differently and may not take me as seriously. So those are challenges to be overcome. And so again, both advantages and disadvantages.
I'm CEO, so I should be a strong woman. If I would like to I must go ahead. Every day I have a lot of challenges in my area, in my company. Telemedical staff is very challenges, and we need to, I need to go ahead. I need to support my team and have a vision. But like I said, when I started with my company, I started in Women Foundation. It was really good. It was really good start. And now around over my company and inside my company, there are a lot of women. And I believe in the power of women. I think that we should support and when I think about my vision and my vision of my company, I know that the woman can give me a power, and I can go ahead with my team.
So there is a study published showing that women entrepreneurs are like 20 or 30% more successful. I don't know if anybody read that before. So I think investors should know that. And the reason why is women entrepreneurs are very, very careful about the money spending. Because a lot of stuff fail is because they run out of cash. So for us, whatever the money we receive, we calculate every single dime, to figure out how to make it successful. And I think that's just naturally part of us being a woman. And I feel fortunate and very grateful to be identified as a power woman. Because for me, it gives me this opportunity to share my story. And being an entrepreneur is, can be a little bit like this, a roller coaster, right? Like, there's good days, there's days you just like, right? And, especially when you're trying to navigate through this healthcare, system where myself is not familiar with. And I have to say, there's a lot of encouraging words for people who reach out to me after they hear my talks, or they email me, or they come to me and telling me that it's really inspiring and keep doing what I'm doing. I know in the beginning will be hard, but it's going to help a lot of people, and it's going to be very fulfilling in coming back to me. The other thing I would suggest is definitely for women who's in the most senior position, especially with extensive background in healthcare, open your heart and open your arm to help younger entrepreneurs who are trying to figure out how to innovate in healthcare. I have some male mentors who's been very helpful, but I can see there is a different perspective than how being a successful women executive in healthcare, how they made it versus a male who made it, in leadership. The pathway, the personal experience will be very different.
Well, I have a lot I could say on this, but basically, how lucky are we that we are in the United States of America, and we as advocates have can make change. I came in from the outside. I didn't come in with a degree in public health or in political science. I came in as a consumer that was denied access to care in the early 1990s for a surgical treatment I needed in my jaw called TMJ. And that unleashed my spirit in a different way than I ever thought it would in a lifetime. And because of that spirit, and because of that story, and because then you want to work on fixing the wrongs that are being done in the system, you start to build. So my motto is many voices come together when one voice stands up. I've been able and so blessed to build many coalitions that have changed the entire direction of this healthcare system. And now I know that we have to work on it all together. Maybe one person driving everybody to the table, but to that table we need to work. And I just wrote a book that was published, oh my God, it took 9 years to write this book. It was just published a couple of weeks ago, finally. It's not out on ebooks yet, but it's coming. And on the back cover, and I think this really fits into what this says, this is the power of one, an often overused cliche, but the sole message of it, and the name of this book is Healthcare Unhinged, the Making of an Advocate. So it's my personal story, but then it goes into how we can build and make changes together. So I want it to be an inspiration for next generation advocates. But this goes on to say, one woman is joined by many to face down one dragon at a time, one voice joined by a chorus to alter forever the conversation. And that is so true, because that's what we do and that's why we're successful. If I tried to do this by myself, never would happen. But by bringing all the people together, if you don't know the answer, you find it. If you need the data, you get it. And 3 years ago, I was elected. This was so phenomenal for me. I was elected to the board of the California Healthcare Performance and Information System, which is CHIPI. And we're going to be releasing data this year. It's taken 3 years to get there. These are the health plans. These are the COs and CEOs of the health plans that voted me in. I've been the thorn in their side for for almost 2 decades. And they finally voted me and said, okay, we better bring Helms to the table and let's work on it. And we've done it, and it's a great group of people, and I really enjoy it. And so working with the health plans is vitally important. They're not the enemy. They're just trying to figure it all out, like we all are. So together we'll be able to do that.
Great, thank you. And with that, I'd like to bring together the voices of those in the room, and we welcome any questions for the panelists today.
As a woman, I identify myself as a professional in the health field. However, I'm in my middle 30s. I have 2 young kids, so I also know in the next 10 years, I will, if I work, I will need a flexible work. But in my perspective, the community, this society doesn't have enough room or enough opportunity for women who want to survive, but they need flexible works.
I think there's so much to do. There's so much to do, and especially if you're home, if you need to be home. Oh my God, we find people that can work from home to work on our team. We don't have to have people in the office all the time. Virtual technology. I mean, technology in that realm is so much better than it was before. When I started, I didn't even know what a computer was. I mean, somebody said something about the information highway, and I go, what is that? And now I type faster than my computer can put the words in. So that's my thoughts, getting my thoughts out. So we have lots of people that there are opportunities, and I would say just keep looking and talking and going to meetings and seeing what your needs are, and then find the way that you can fulfill that need by finding others that have common goals that you do.
I think our innovations actually kind of provide that sort of flexibility, because my initial motivation was not only just helping patients and also helping all these artists, musicians, dance teachers who struggle to make a decent living doing something they're extremely passionate about. And now with my platform, we can help you modernize your teaching. You can teach from your house, from your studio. And then the cool thing is we build this live video platform that is robust enough for you to dance and not freeze on the screen. You can pretty much teach anything. So, if you have a strong skill set, you can check out our platform. Maybe, you could take care of your kids at home and teaching something, from there.
Having had 2 kids and a career during that period, I can very much empathize with your dilemma. I think that's part of the challenge for at least many women, not all, but many, is how do you balance that career? And of course, then you get into the ongoing polemic around, do you lean in, right? Or there was another book that was written by a Princeton grad who essentially said, I have a different path than my husband. I have to lean back, so to speak. I think this is very much an individual choice, and I appreciate that there are lots of support and people you can talk to and whatnot, but frankly, I was overwhelmed with that because I was so busy just working and taking care of my kids. I couldn't take advantage of them or look into, find more resources. So all I can say is for myself, for a period in time, my work was, I leaned back a little. Life is long. My perspective was life is long, and I will have time to lean forward. I didn't anticipate I was full guns when I could, but when the kids came around, I leaned back a little. And I can say I worked when they went to sleep, and I tried to keep the gas going as much as I could, but I can say that I've been through that period, and I'm now into another period of time. So that's the choice I, as a woman, as an individual made. It's a challenge. It's hard, and good luck to all of you that are going through that, because it's hard, but it is the most fulfilling thing I've ever done. So.
Hi, I'm Jessica, and I have 2 questions. My first question is, as a young woman joining the healthcare field, what is your advice on how to gain that leadership role later on in your career? And my other question is, we know that women are underrepresented in medicine, right? There's a minuscule amount of surgeons that are female, and what are ways where we can empower women to go into those fields later on?
Okay, I have 3 tips for you. The first is you should have your vision. You should be really strong, and I know that it is popular. Never give up, because every day you will have more and more challenges. But you should be strong and go ahead. And the next, you should have good people around your vision. You should have a good team. I think the women should have team.
I can add to that. Let's see, so tips. I would agree, although it is heartening, medical school applicants, I think, are increasingly, there's a higher and higher percentage, so I think that's wonderful, and certainly doctors, physicians are traditionally big decision makers and have a lot of say, a lot of power in healthcare. So that's a wonderful indicator, certainly folks that have MBAs and can go into those CEO positions and those board positions. My own point of view is that to look for the future and to think about where you think healthcare is going to. So I'm very biased because I thought healthcare would be moving towards technology, would be moving towards analytics. It's an area, both of those areas were loves for me. They were parts of my passion and parts of my vision. Back to what Agita said, I would agree with her. Anticipate those skill sets that will be needed, right? And get experience in those, taking some risk. and working in a variety of different areas that help to show those leadership qualities that you hope to enable. I think finding a mentor or a sponsor that can help give you advice as you come along and develop, because very few of us are ready to be leaders day one, coming out of school. And so part of that is finding people that can help see what you see in yourself and help you see maybe even things that you don't even see in yourself and helping to bring that out. But I would anticipate what are the things that we will need for leadership in healthcare 10 and 20 years down the road, start to develop that and get those experiences.
And I can add just a little something to that. So I'm really excited because some of the work that we do works with all the different universities. So with the UC system, USC, Stanford, we work with the Stroke Squad here, with the Right Care Initiative, reducing heart attacks and strokes. That brings all the medical groups together every month to have discussions on how we move that forward. And we meet people all the time. So this year I have been working with a pre-med student. She's just graduated from UC Berkeley. And she is going to come to work. Now she's going to go into med school. But she's taking a break, and she's coming to work with us to work on the public policy side of healthcare as our intern. We're going to have her for a year. While she's working, she wants to go and get her medical degree through the Navy. So that's going to take her a little bit of time to make that happen. But she's so determined to get her schooling through the armed forces, like her family's done. And so we're really excited about her. I just came back from a meeting in Denver where they brought in two interns. And those interns are #1 on the list for getting hired into other jobs. So that background in working with some of the medical groups on some of their issues and learning them and building relationships with physicians that you might want to work with later on, that would be a really good inroad to helping you, especially if you need letters of support or things like that. That would be very helpful and beneficial.
My advice would be a lifelong learner and diversify your skill sets, especially nowadays. I have I invite to speak at different conferences, so I have a huge group of friends who they not only MD, they also have MPH, they also MBA, they're social media queens, and these are the people who have the influence power. When their skills are so diversified, they just stand out from everybody else. So, whatever it's hard right now, even though it's not your training, learn it. There's so many online classes you could take. Learning as much skill set as you have, it's going to make yourself incredible, valuable for any organization you're going to join.
I speak again. So it all starts at the very beginning, in early childhood. There's something called division of responsibility. It doesn't matter if you're born as male, female, transgender, whatever. I think what's important is self-advocacy, which is key to any leadership quality. It starts very early. If the parent doesn't take away the power of the child, where the child was supposed to make the decision of whether to eat the food or how much to eat, and the mom said, no, you finish this because it's got to finish, that's when you took the power away from the child. So there's a lot of parenting classes going on in Santa Clara County from 5 Keys, which focuses on this very key point. It doesn't matter. I think every child is an entrepreneur. You see this in high schools. You see this all the time. Just don't take it away. Don't take the power away or give your power away. I don't think anybody really takes anybody's power away. I think you just have to find your voice, like most of you said today. And I think everybody here needs to also know that you just have to find your way. I've started a meetup where 73 people, non-doctors, I'm a family physician, I try to gather all kinds of alternative medicine to be there for my patients, because they do go for acupuncture, they do go for dancing classes. They ask me, where do I go? I'm like, the other day the patient said, I don't want to take your allopathic medications, I want naturopathy. I'm like, I Googled. So basically, trust me, all these people wanting to receive care want you. But how do you get there? I hope there's a platform like Facebook which would allow doctors such as I who want to integrate you into our system, and you who wants to partner with the doctor. I think I had huge barriers. I even tried to go to Dr. Jeffrey Smith, which I didn't get the time to, but I'm sure I will, trying to get those 73 entrepreneurs in the community to integrate into community health centers. I hope somebody will create a platform. I'm speaking to the entrepreneurs here who are not medical or technological. Maybe create a platform where it's just not going to be for those high-end Google type of companies where doctors giving their time to advise. I think there should be a platform where any doctor or nurse practitioner, physician assistant, who's always constantly trying to improve healthcare should be there for those the dance group companies or music, and the research has shown they do matter. I think telemedicine is the way to go. If you just get into that electronic health system through the patient portal to that patient, and we clear the patient for that dance, I think the patient should be dancing. Basically, there should be a platform like that. Hopefully, someone's going to create it soon before I die. Hit by a truck and die. I'm saying that, but that's what I'm hoping. Maybe you should look into those.
Unfortunately, my timekeeper is telling me we have 1 minute left. Maybe we'll just take one last question or comment.
I just have one comment. Our platform is actually live video live, so you can tell your patients. They could directly doing that.
We did have one.
Sorry.
Karen Bauer, Health Technology Forum Advisor. Thank you, Pranoy and panelists, for such an inspiring panel. My question is, what is the single most challenging obstacle that you faced in your career as a power woman in healthcare?
In the very beginning, when I got my first denial to access to care, and I was sick. I was really sick. I didn't know where to go or who to turn to, and I felt so beaten down. And then I found my way because I didn't give up, and I got to the surgeon that I needed to get to that decided that he was going to do the surgery, and he overrode everybody. That was my biggest hurdle because I was sick and I couldn't get care. Once I got the care, 6 weeks later, I was back to work, and I've never stopped running since that day.
I think for me is I'm a patient entrepreneur, and so I need to navigate through this puzzle so that I can allow my innovation to grow and flourish in healthcare. That I can, serve my original passion of helping more and more people who can benefit from this.
The biggest challenge in my career was implementation my innovation system in hospital in Europe, because it was really hard. Innovation is, the society is not prepared to, the hospital is not prepared to use this kind of system, and it was a really big challenge for me. But now I do it.
Yes, tough question. Toughest challenge as a woman in healthcare, I think, is the balancing act. We talked about the children and the career at the same time. There's just not enough hours in a day. Also the expectations that both my colleagues and people that reported to me, I was told, I would read about, oh, you should be a leader, you should, I don't want to say, be strong, right? Be forthright, and yet you have to be nice. There's expectations that you are, there's just, it's different, the rules are different for women. And so I think that was hard as well. And certainly I started my career at a time where there were even fewer women in leadership roles and fewer role models. I think we have more now, and that's terrific. So hard to pin one, but I think it's around that balance